Hello, this is a brief review for the Hommak upper arm electronic blood pressure monitor. This is model U83H. Let's check out some of the functions. Now what I really liked about this one is there's several functions. It's got a 3-minute auto power off. So if you forget to turn it off, it'll turn itself off. Also, if you look through the first 20 pages or so of the user manual, which is in English, part of it's in English, you'll find out that there are two settings for 2 users. So in other words, you can have 2 different users and up to 120 measurements will be recorded. Should you choose to erase those, then you can look at the manual for directions how to erase the previous readings. Now when you open the box, obviously this is what you'll find. You'll find the carrying case, the monitor itself, the user manual, and the arm cuff. If you flip it over, there's also a place for the 4 batteries that also come with it, AAA batteries. Unfortunately, this model, although it has a port for a DC adapter, it is optional and does not come with a device. So you have to buy one, and if you do want to buy one, make sure it has a 6-volt output. So let's give it a try. And as you can see, it's beeping. When you first turn it on, it will ask you to set the date, time, year, so forth and so on, like most devices. So let's use it. Now if you notice, the cuff has this little arrow on it, making sure that you point it down on your arm. So let's give it a shot here. It doesn't take very long. In fact, it shouldn't, as long as your arm is in the right position. So left arm is preferred. Now if you have to use your right arm for whatever reason, make sure that in every reading that you're consistent and continue to use the right arm. But we'll be using the left arm. So let's make sure we have this right. Our arrow is pointing down, and it should be just a little bit above our elbow. Not too tight, but a little bit snug. Let's make sure, it's got a little picture there. Let's make sure that's correct. A little bit above the elbow. Okay, we're ready to start. So make sure your arm is steady, pointing straight to your heart, and we'll get a good reading. So let's give it a start. And that's that. So it shouldn't take very long to get a reading. If you find that your cuff keeps inflating, it's because your arm may be in the wrong position, or maybe this is backwards. Remember, the arrow points down. So if you have trouble with any of these features that we've looked at today, please use your user manual. There's also directions on pages 16 through 19 of how to care for it, how to clean it, and please make sure not to use anything corrosive. Thank you for listening.